Miss Shandik.
Hi there. How are you?
Good, thank you. I'm Chandler Zalek. I'm a student nurse practitioner.
Fantastic.
So what brings you in here today?
I am here for a full skin body assessment.
Okay. Sure. Do you have any concerns that brings you in, or you're just kind of here?
Just a few pieces of acne that have been showing up more frequently on my face.
Okay. All right, great. So before we get started, do you have any personal or family history of melanoma at all?
We do not.
No skin cancer in the family?
Nope.
Okay. Another question for you. When you're out in the sun, do you use sunscreen?
No.
Okay, that's definitely something I can give you some information on. It obviously is a super important preventative measure to protect yourself from those harmful UV rays. What about tanning beds?
Periodically, I do.
Okay. And have you noticed any, I see you have some freckles, have you noticed any change in your skin color, any new or moles, or any moles growing bigger at all?
Not that I've noticed.
Okay. All right. Sounds great. I'll give you a second. I'm going to go wash my hands and grab some gloves. If you just want to lay back from me onto this pillow, I'll get you a sheet. We can cover up your legs and we'll start, okay?
Awesome.
All right.
Fantastic.
Hi, Miss Shannon.
Hi.
All right. Let me just cover up those legs. I know it can get a little bit cold in here. All right. So I'm going to start with a skin assessment. And for that, I'm going to start with your scalp. Okay, so I'm just going to put my gloves on. Now, when I'm looking at your scalp, I'm looking for any lesions or maybe any infestations. Okay, everything looks good. Now, one of the only things I would recommend is, because of the fair nature of your skin, maybe when you're out in the sun this summer, to wear a hat.
Okay.
Just to prevent your scalp. While we're here, I'm going to now just be assessing for the texture of your hair. Your hair seems to be smooth, very evenly distributed. You got a full head of hair, which is good. Do you dye your hair at all?
I do.
Okay. And do you notice any breakage or dryness when you do that at all?
Breakage, although my hairdresser has been, making sure to do everything necessary to keep it from breaking.
Okay.
So.
All right. Excellent. So the scalp looks good. I'm now going to move on to your arms.
Okay.
Okay. So I'm just going to look at them, the undersides. Okay. I noticed just patches of macules, which are just brown freckles. They all look relatively normal. Nothing's bigger than 1/2 inch in diameter. That's when we do start to get worried. Okay. Your skin is smooth. It's warm to the touch. Good. Now, while we're here, I'm going to do a skin test for turgor and elasticity, okay?
Okay.
Just going to be a little pinch. Perfect. That also can indicate hydration status. It seems like your skin, it's warm, soft to the touch. It seems like you're pretty well hydrated. It goes back to its state fairly quickly. All right. I'm just going to slowly remove this a little bit. Okay. I'm going to take a peek at your legs. Okay. Can you lift it up for me? Good. Very good. And this one? Okay. So you have a little cut here. And what's that from?
Bug bite.
A bug bite. Okay. Do you wear a bug spray when you're out? Typically? Okay. Yeah, that just looks like a little mosquito bite. But something you can do to help yourself with that is just use bug spray. Okay. Now I'm going to look at the bottom of your feet. Good. No abnormalities. I know it's kind of a silly place, but some people do get moles on the bottom of their feet that we can be a little concerned about, but everything looks good there.
Okay.
So now you mentioned that you were having a couple more breakouts.
Yes.
Let's see. Okay, so right here in that area, I see some, it looks like just typical acne vulgaris. Do you use any cream at all for that?
I do.
Okay, and what do you use?
Typically I use facial cleansers, things like that.
Perfect. If you want, I could give you a prescription for a salicylate cream, and you can just dab that on at night, and sometimes that helps with that.
Sure.
Okay. All right. So now, the only other thing I want to look at is I'm going to look at your nails next. Okay. So I know that kind of seems silly, but that's part of the skin assessment. All right. So when I'm looking at your nails, I'm looking for the firmness of them. They seem pretty firm. They're not too thin. They've got a nice color to them. I'm going to assess for capillary refill. And what that means is when I press down, it goes white and then it gets red again. That's healthy within 3 seconds. That's perfect. Okay. Do you notice any brittleness or breaking of the nails at all?
No.
No? Okay, perfect. Now I'm going to check the toenails. Same thing with the capillary refill. Good. They look good. They're all rounded. They're all the same shape. Perfect. All right. So I'm going to now take a look at your back. If you could just please sit up for me. Excellent. Perfect. I'm going to move your hair out of the way. All right. Back looks good. Skin again is warm and smooth to the touch. Now you do have one mole back here. I'm going to press on it, okay? You tell me if it hurts.
Sure.
Does that hurt at all? No? Okay. Are you aware that you have this mole back here?
I wasn't.
Okay. So this mole, it is all one color, which is a good sign. It is a little bit bigger than a half of an inch, and it looks like the borders are a tiny bit irregular. Just to be on the safe side, I would recommend a biopsy.
Okay.
Okay, and that's just to test for any melanoma or anything like that, just to be on the safe side.
Sure.
Okay, and if that's something that we do, I'll obviously get a consent form signed.
Sure.
We can do it right here in the office. Doesn't take very long.
Okay.
We numb it up a little bit.
Alright.
Okay. And then besides that, the back looks good. And then just with that, I would just recommend a yearly visit with us,
Okay.
just so we can kind of keep an eye on that, and just rather to be safe than sorry.
Sure, absolutely.
Okay. And then, did you have any questions?
No, you answered everything.
Okay, perfect. So I'm going to go talk to the attending physician. Something I just like to always tell my patients with education regarding skin evaluation is an acronym ABCD.
Okay.
And there's just kind of things to look out for that might spark a concern that would bring you in here, okay? So A is asymmetry. So if you notice a mole or a lesion that pops up, if it seems like the sides are irregular at all, and they start to change a little bit, maybe it was a perfect circle, but it kind of forms into something else, that could be something that you'd want to come see us for. B is borders. If your borders become irregular at all, or they're raised or they're bumpy, that's something else you want to give us a call for. C is color. So a normal mole would be a solid brown color. Once it starts to get two-toned or three-toned, like black, brown, maybe a little red or a little blue, that could spark some concern, and we would definitely want to check that out. And then D is diameter. So, like as I said a few times, anything above a half an inch is what we want to check out. Not saying that anything below a half an inch couldn't be a sign of concern, but the bigger they get, the more we want to keep a close eye on it.
Okay.
Okay, so I'll go talk to the other physician. And do you have any questions for me?
No, that's
No?
it.
All right, Miss Chanday, I'll be back in a few minutes,
Thank you
okay?
so much.
Thank you so much.